Live from the KHOU 11's studios, it's Great Day Houston. And now, here's your host, Deborah Duncan.
Good morning and welcome to Great Day Houston. We hope you had a great weekend. The gorgeous warm weather means we can shed some clothes, and pretty soon we'll almost be bearing it all in our bathing suits. Is that a frightening thought? Would you like to shed a few pounds first? Well, many people are trying the latest diet trend. It's bone broth. Is that a viable way to lose weight? And are there any side effects? Let's see what our doctors think in Medical Hot Topics today. And on our panel, bariatric surgeon Dr. Clifton Thomas, orthopedic surgeon Dr. Stephen Brown, neurosurgeon Dr. Nilesh Katecha, and ophthalmologist Dr. Colby Stewart. Good morning.
Good morning.
Good morning.
All right, so we're always looking for that magic pill or that magic diet, and we will do exactly what the instructions say, even if we're starving ourselves, right? So bone broth, this latest thing that a lot of people are trying.
Well, there's always the new fad, the new thing, the new food, the new pill, the new whatever that's going to suddenly change everything. It's kind of interesting. Early man, actually, when they were scavenging for food, would eat bone marrow and bone broth. So it is full of nutrients.
Okay.
But, you know, everyday farm-to-table food has a lot of nutrients, too. If you don't like bone broth, I wouldn't eat it.
Yeah.
But you know,
and man cannot live by bone broth alone, right?
Right.
So it's like you're drinking bone broth all day long, and that just does not look appetizing to me. But yeah, we make chicken soups and we get our broth and stuff like that. But the idea behind this is that you're getting your calcium, your magnesium, your glucosamine, and all that type of stuff. But again, as a diet, that doesn't work, does it?
You know, I think you should eat the healthy food that you like the way it tastes. And if you like bone broth, it is full of nutrients. Eat it.
Yeah.
I actually tried it. I wasn't so crazy about it. It's very fatty.
Well, you know, if you add a little butter to it, just a little pat of butter, it gets better.
I like butter.
Yeah. And Dr. Brown, of course, having all the calcium, magnesium, all that stuff is good for our bones.
Absolutely.
But the thing is, again, it's not a diet. You can't live off of that. All right. There was another study that came out that said that men have more complications after total knee and hip replacements. 15% more likely to visit the ER, more likely to have a heart attack within 3 months after surgery. What is this connected to? Is it really connected to the surgery itself, or are there other pre-existing issues that a lot of men may have had?
There may be other issues. This is a study which was recently presented at our academy in Las Vegas a few weeks ago that say that men have more complications than women. It was studied over about 6,000 patients, but the complication rate in total knee replacements is so low to begin with. It's about 1 to 2%, and they're very rare. They happen, and in some cases, men do have more complications, such as infections. We don't know why.
Yeah.
But it should not be a reason not to have a knee or hip replacement if that's true.
Yeah, because otherwise you're living in pain, you're not mobile.
Exactly.
That causes a whole host of other issues.
Exactly.
All right.
Exactly. Okay,
so we're always looking for, when it comes to spinal cord injuries, we're always looking for what can help either put someone on the mend quicker or get them up and walking. And an existing cancer drug can help those with spinal cord injuries, but to what degree?
So ipothalone actually is a drug. It's actually a substance that was actually studied for cancer treatment or prevention. And it's a drug in low doses actually helps prevent scarring after spinal cord injury. The biggest problem that happens is after an injury to the spinal cord is how functional does a person get? How quickly does the spinal cord recover? Most of the times what happens is scar tissue, which is what actually heals a person after a cut, actually starts healing the spinal cord and actually prevents flow of signal from the brain.
Right, because it's that thick tissue there that blocks everything off.
Exactly. So this drug actually in low doses stabilizes what's called the microtubules. So microtubules are actually a skeleton within the cell. By stabilizing it, it actually allows two things to happen. Number one, it allows the axon, which is actually the fiber of the nerve, to grow. Number two, it prevents the migration of scar tissue to the spinal cord and also to the brain. The beauty about this particular substance, it crosses what's called the blood-brain barrier, which actually prevents drugs from getting to the brain. So you may get to it, but the structure of the blood vessels prevents the drugs from getting out to the tissues. So
and that's where the healing can come, with blood getting to the tissues, right?
Exactly, and this drug actually goes to the brain tissue or the spinal cord and prevents the migration of the scar tissue cells.
Wow, I can imagine that even being used in other issues where we have scar tissue. I know I was supposed to have surgery on my shoulder, and I didn't, because my concern was I would have more scar tissue in my cutting through my muscle. And they ended up doing like a laser that got the blood flow there, and that broke up that scar tissue and made all the difference there. All right, another area where we're always searching for a cure for is blindness. And with this particular situation here, stem cells from the patient's own stem cells that can help in terms of restoring the eyesight. But there's two different things we look at with blindness. One is we can say legally blind, and when someone, let's say, was born and is completely blind, and then of course there's diseases that lead to blindness.
Right. I mean, the most common cause for people to go blind, if you want to say that, is things that can usually be treated. I mean, probably in the world, cataracts is the number one. These are things that can be treated. Macular degeneration is a very serious thing, as we all know about, but usually macular degeneration gets your central vision. So you still have a little peripheral vision off to the side. And they're working on some things, right, with stem cells and also a computer chip that can go inside, lay on the retina, and then you wear a pair of these glasses that can give you feedback. Now, you're not seeing like the Bionic Man, and you're not seeing like you could see if you didn't have this macular problem, but you can tell, for people that can't see anything in their central vision, to be able to tell that there's a person there or a body. I mean, that's a big change.
All right. Something else that's come up, the first junk food tax has been put in place in America on a Native American Indian reservation. We know that other cities have placed taxes on soda, but this is the first full-blown tax on all junk food. Today on Facebook, we want to know, with obesity such an epidemic and the cause of so many fatal diseases, will a tax on junk food get people's attention? I don't know how effective the sin tax is with cigarettes and alcohol, but maybe the money they get from those taxes can help pay for education on how to eat better. Log on, let us know what you think. We'll share some of your comments later in the show, but right now I want to talk to you all, because in every one of your areas, obesity has a big impact. Does tax make the difference? Is there something else that will make a better difference?
I think there is something that make a better difference. So I believe in small government. I think it'd be too complicated for any kind of government reform in that direction. But the best way to help other people change their eating habits is to mentor them. That means when you choose to eat food and you're eating in a healthy way and people see how you responded to it, then after a while, they're going to want to eat that way too.
Yeah.
That's the way to do it.
Right. Because you get patients who come to you, and again, obesity is an issue. It impacts you, obviously, as a bariatric surgeon. You see the type 2 diabetes, the whole bit. We know that type 2 diabetes is a big impact in your area as well.
Absolutely. Obesity in orthopedics is a huge issue, and obesity is a big problem in this country, as we all know. This country is got higher obesity rates than I think most everywhere else in the world.
Yeah.
I don't know if taxing is the correct answer. I agree. Education is the right way to go here. My patients know I hate the word diet. It's a lifestyle change.
Yeah.
It's a lifestyle change. It's learning how to eat healthy, smaller portions, exercise, and so forth. I have so many patients coming in with painful joints. And if their BMI or if their weight is extremely high, that makes a huge difference.
Yeah.
And weight loss surgery, for example, losing that weight, they'll notice a difference within just a few days.
Right. Yeah,
or diet, or not dieting, but eating correctly and so forth, and losing weight, they'll notice a difference.
Same when you have back pain. If you have back pain, if you can take the pressure off.
Exactly. So taking the pressure off the back actually reduces quite a bit of discomfort and pain. Majority of the patients that I see in my practice, I'd say 90+% are classified as being obese. Of that, I'd probably say 25% are morbidly obese.
Yeah.
So diet absolutely plays a big factor. I think the big things that are lacking are education. Some of these patients that I see, they do not get, obesity does not get addressed by the primary care physicians for the fear of offending them.
Right. We look at, I think, obesity we look at it as an aesthetic issue. So it's like we don't want to offend somebody. It's an aesthetic. It's not an aesthetic issue. It's a health issue, and literally it will rob you of so many different things. I keep saying type 2 diabetes because I think a lot of people think type 2 diabetes is a disease over here and obesity is over here. They are very much related. One of the top reasons why people can go blind.
Yeah, I mean, diabetes is probably one of the #1 reasons why people can, and it's very difficult to treat in a lot of cases. But kind of getting back to the political side, I don't think taxing somebody for having a cupcake or a donut.
It just means I pay more for my cupcake.
That's right. I mean,
yeah.
there's people that just don't eat. That are never going to eat right, no matter where. So I don't think
we've raised a couple of generations that way.
Well, that's
it's
true.
quick and easy, it's fast, and it's sweet, and there you go. And so we need to get back to that seed to plate type thing that we talked about, and really realizing what food is about. Yes, we can sit around and enjoy it with friends. It can taste good, but you're putting nutrients into your body. That is your first line of medicine, if you will.
Absolutely.
All right. Well, we're going to find out what you think. Log on and let us know. Coming up, sometimes the healthiest thing you can do is to reach out for help when the struggle with weight is too much. The tool that finally helped this couple to shed the extra pounds and live life happily ever after.